The governor's extension this week builds on an effort to slow down the COVID-19 pandemic. For counties in northeastern Minnesota, that's kept the number of cases at a reasonable level and avoided a spike in patients at local hospitals. Earlier this week, Almanac North producer Greg Grell talked with Jenny Barta, Carlton County's public health nurse, about the pandemic.
So as of today, which is for us, it's Wednesday, April 8th, we currently have 14 labbed confirmed cases in Carlton County.
Now, several of those are at the prison, and there are 5 in the county outside of the prison. Is that correct?
You would have to refer to the Department of Corrections website to be sure, but the Department of Corrections confirmed cases are included in our case count.
So now, as access to testing is starting to improve in the state, are you expecting now to find more cases in Carlton County?
We can expect an increase in lab confirmed cases when access to testing does improve. However, it's likely that we already do have some community spread happening all across Minnesota. So it's important to keep in mind that the majority of cases are mild to moderate, so most people will recover at home and will not require testing or medical attention.
So what are some of the biggest concerns that you are hearing from Carlton County residents about COVID-19?
Well, one of the concerns that we've heard is how fast the spread of COVID-19 will happen in our community. So we've recently released some guidance on homemade face coverings that was recommended by the Center for Disease Control and Prevention as another added voluntary public health protection measure. We've also been emphasizing Governor Walz's order to stay at home as much as possible and continue these primary prevention measures such as washing your hands, using alcohol-based hand sanitizer when you can, also covering your cough, staying home if you're feeling sick, and maintaining that good social distance from other people.
Now, there do seem to be some encouraging signs. The governor's stay-at-home order may be working. The Minnesota Department of Health shows that the spread seems to be pretty flat. Is that encouraging news for public health officials like yourself?
Yes, in fact, it is. The Commissioner of Health has shared that they've been working on ways to track this effectiveness in order to stay at home. So we've not seen a steep, sharp rise as other places have seen. So initial results show that it is helping to flatten the curve in this pandemic, at least in our neck of the woods. Based on current cell phone data too from the Department of Public Safety, traffic in the month of March has decreased by 71% in northeastern Minnesota. So that is showing that we are following this order to stay at home as much as possible.
Yeah, that's good news. Good news. This weekend now is Easter, and that's a traditional time for family and friends to gather. Does that bring along any increase or concerns about an increase in the infection rate?
Yeah, in our recent press release, we had tried to reiterate the importance of staying at home and not gathering in large groups so that we can continue in this effort of slowing the spread of COVID-19. We're encouraging people to celebrate holidays, but try to celebrate them at home at a safe social distance. So we know that many of these family gatherings could include people who are at higher risk for complications for COVID-19, such as anyone over the age of 65, especially those with underlying health conditions. So we want to continue to protect that population as much as possible.
Are there any additional things Carlton County might be doing also to limit the spread? I know you're following the Department of Health recommendations and the CDC recommendations.
Yeah, we're trying to send out messaging to the public in different ways, such as through our daily press releases, social media, and also through our website. And we're working currently on a community mailing. County services have now limited face-to-face contact. We've adjusted those services to provide some of them via telephone or through a secure video conferencing service.
So there are resources out there. People should be looking for those resources.
Yeah.
Do you have some general recommendations, information for people at higher risk that they should really be paying attention to?
Yeah, so if you're somebody who's at higher risk, we are really encouraging you to stay at home as much as possible. And if you're able, reach out to family, friends, neighbors to do shopping for you instead of you going out into the community. Also for community members to be checking on their neighbors or family members who might be at higher risk and trying to provide needed services for them. Continue to wash your hands frequently. If you do need to go out into public, you can use those face coverings that the CDC has recommended, and MDH has also sent out some guidance on that. But keep washing your hands frequently, and also contact your healthcare provider if you do feel like you're experiencing any symptoms, and contact them early rather than waiting until later.
And where can people get the most up-to-date information if they're concerned about the spread, especially in the county and in the area?
Well, you can check out our website, www.co.carlton.mn.us. And also, please continue to check out the Minnesota Department of Health website. They have COVID-19 web updates every day, as well as the CDC is coming out with new guidance and recommendations daily. So those would be your best websites to check.
Are you worried at all about the public health infrastructure in Carlton County? Do you guys think you're pretty well prepared for whatever may come?
I do believe that Carlton County has a very good public health infrastructure. We've been working with an incident command system already for the past few weeks. We've been having daily meetings, and I believe that we have some good plans going forward, as well as working with other community partners like Fond du Lac and other Northeast counties. So I think we're going to be doing okay.
Well, Jenny, thank you very much. Appreciate your time, and good luck taking care of this in Carlton County.
Yes, thank you so much. I appreciate it.